I'm going to just be touching and feeling if there is anything unusual, any deformities. And I'm actually going to percast the lung fields. Maybe a little bit deeper. Perfect. That's great. Get here. Also palpating the sternum. Okay, now here at the ribs. Anything painful?
No.
Listening to the bowel movements. Okay, perfect. Now, the second quadrant. With just the moving of the legs. So, I will ask you to just put your knees here. Perfect. Now, the other leg. Okay, perfect. Now, okay. Now here. And here as well. Okay. Now just try to. And now the maxillary sinuses, which are here. Do you feel anything painful?
No.
Okay. So, okay, I'm visualizing the optic cup and the borders are pretty clear and solid. From the other side. Hi, my name is Dr. Kewa and today I'll be performing a full body examination on you. Is that alright?
Yes.
Perfect. So, first I'm going to ask you several questions to assess your memory and cognition. Is that alright?
Yes.
Perfect. So, could you please state your name, full name, I mean?
Yeah. My name is Rebecca Stone.
Rebecca Stone, okay. How old are you, Rebecca?
45.
Okay, 45. Do you happen to know what time of the day it is at this moment? Around, it doesn't have to be like strictly precise, just approximately.
Approximately 8 p.m.
Yeah, 8 p.m. Perfect. So I'm just going to general assess you first. You seem to be somewhere around 178 centimeters. Is that correct?
177.
Okay, 177 centimeters. Perfect. And your weight seems about 60 kilograms.
58.
58 kilograms. Okay, perfect. Okay, so I'm going to ask you now just several basic questions, and before we do that, I will actually give you 3 words to remember. It's going to be dark, then green, and light, for example.
Mm-hmm.
So could you repeat those words for me so that you remember them?
Mm-hmm. Now?
Yeah.
Okay. Dark.
Yeah.
Green.
Yeah.
Light.
Yeah, perfect. So I'm going to ask you now some very random and easy questions to answer. So could you tell me, like, what color is the sky?
Blue.
Yeah, it's blue. Okay, could you tell me what is the capital city of Prague? Okay. Okay, so what is the capital city of Netherlands?
Amsterdam.
Yeah, perfect. And yeah, this would be it. Could you please tell me the 3 words I gave you before we started?
Okay. Dark.
Yeah.
Green. Light.
Okay, perfect. So it seems that you are perfectly mentally alert. Okay, that's great. So I think that we are done with this. Now I'm going to ask you to touch your nose with your pointing finger, and I will have there my pointing finger. You will try to touch with your mind and then back to your nose, okay? Okay, and back. And as fast as you can.
Oh, okay.
Okay. Okay. Okay, great, stop. And now the other hand. Perfect. All right, that's perfect. Thank you. Okay, so I'm now just going to look at you very briefly, and generally I'm going to look at your skin on your face. If there is any muscle wasting as well, I'm going to look at your symmetry, if your face is symmetrical. Okay, and that seems to be perfectly fine. Perfect. So now I'm going to actually do your scalp inspection. I'm going to touch your scalp and I'm going to feel if there are any bumps, lumps, lesions or anything like that. Okay? So I'm going to ask you to bend forward a little bit. Okay. I'm going to just be touching and feeling if there is anything unusual, any deformities. Okay, and that seems to be fine. Alright, you can sit normally now. So now I'm just going to look at the color. Are you having like full makeup?
No.
At the moment, okay. So I'm just going to look if there is any redness, any lesions, any swelling, in case there might be an infection. However, your color of the skin seems normal for your ethnicity. As well on your hands, I'm now going to just feel the texture and the temperature of your hands as well. I'm also going to ask you to show me your hands from the inner side. Perfect. Now the other one. Perfect, great. So I'm just now going to feel the skin if there is anything unusual. Okay. I'm just going to ask you again to turn your palms. Okay. And I'm going to actually assess the temperature with the back of my hands. Okay. And they feel nice and warm. So you have a good blood circulation. That's perfect. I'm also going to try the trigger test. I'm going to like pinch you and just see, yeah, if the skin is coming back. So all appear normal and healthy. That's great. So now I'm going to actually try some like funny faces with you. I will ask you to smile as big as you can with your teeth. Perfect. Then I will ask you to blow your cheeks like this. Now clench your jaw, like you're pressing your teeth against one another. Perfect. That's great. And stick out your tongue for a little bit. Yeah, perfect. That's great. So now I'm actually going to take something to touch you with, and you will tell me when you feel it. You will close your eyes, and when you feel it, you just say yes. Okay?
Yeah.
Perfect. So I'm going to take this brush and I'm going to touch you and say yes when you feel it, okay? Let's try it.
Yes. Yes.
Perfect.
Yes.
Perfect.
Yeah. Yes. Yes. Yeah. Yes.
Okay, now we'll make it a little bit harder. I will ask you to say right if it's on the right side or left if it's on the left side, okay?
Left. Right. Left. Right. Right. Left.
Perfect.
Right. Left.
Perfect. That's great. So your cranial nerve number 5 seems to be all right. Now I'm going to palpate your frontal sinuses, which means I'm going to palpate here, okay? And you tell me if you feel any pain.
No.
Okay, that's great. Perfect. And now the maxillary sinuses, which are here. Do you feel anything painful?
No.
Okay, so now we'll go to the nose palpation. So I'm just going to be palpating your nasal bone, and I will try if the cartilage is movable, if it moves from side to side. Perfect. That's great. Okay, now we will try the TMJ test. I'm going to palpate in between your jaw, okay? And you will now clench your jaw, okay? And now open the mouth and move the jaw from side to side. Perfect, that's great. Great. Okay, so we've got that covered. Now we're going to proceed to the eye examination. So I'm just going to take my tools. Okay, so we are going to try some tests that are very easy, but maybe complicated to explain. So we will just do something like a little show before you will like do it, okay? So first I'm going to ask you to cover one of your eyes, and we will try your peripheral vision, okay? So I'm just going to be moving my fingers, okay? And you will look strictly at the at the tip of my nose. Okay, and I'll be moving the fingers, and when you see the moving fingers, not my hand but the moving fingers, you will tell me now. Okay, so let's do this.
Now. Now. Now.
Okay,
Now.
perfect.
Now.
Okay,
Now.
perfect.
Now. Now.
Perfect. Now the other eye. Okay, so let's do it.
Now. 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 Now.
Okay, that's great. Perfectly done job. That's great. Okay, I'm just now going to ask you to have your head like still, and I'll be moving my fingers and you will follow it, okay? Like this, okay?
With eyes.
Yeah, with your
okay.
eyes, yeah. Tell me when you have any double vision. This means that you will see the finger as if you were drunk, you know, and you would have the double vision. It's alright if you do not have any, actually. Yeah, it's normal. It's
okay.
how it should be. Perfect. So don't worry about this. Okay, that's great. So we have the extraocular movements done. Now I'm going to just look at your eyes briefly, and not briefly, but actually really like in detail. So I'm going to shine a light into your eyes, and I will actually watch the pupillary reflection. So I'm going to just cover this eye and watch if the pupil constricts and dilates, and it does. Perfect. On the other side as well. And I'm going to just have there. Okay. Okay, so direct and consensual reflex is alright. That's great. So now I'm going to shine the light from temporal side, and I will watch if you have there. Okay. No crescent shadow, that's perfect. No crescent shadow. No crescent shadow, that's great. Now we will try. Now we will try. Yeah. The corneal light reflection. And it is intact bilaterally. That's awesome. Perfect. Now we'll get really close to you, and I'm going to look at the eye from really up close. I will be visualizing the optic cup and optic disc. So, okay, I'm visualizing the optic cup, and the borders are pretty clear and solid. From the other side. Okay, and it is intact bilaterally. That's great. Let me now just look at your eyes and keep them still. Okay. No nystagmus. That means that your eyes would be actually moving like involuntarily from side to side in certain directions. Okay, which it does not, which is great again. So you have great eyes. Do you wear glasses by any chance?
Yes.
Okay, so you wear glasses, and do you not see into distance or?
Both.
Yeah, both. Okay, so we will not do the Snell chart because it would be pointless. Snell chart means that you are actually reading the letters. I'm like sure that you already know this test since you are wearing glasses. So you have to be at the doctor. That's perfect. So now we will actually transition to hearing. So I'm just going to take my gloves. I'm going to take my gloves. And I will be moving my fingers, like rubbing next to your ear. And you will show me at which side. Do you hear it okay? So you will close your eyes, and I will be moving my hands.
That side. The left side.
Okay.
Right side.
Perfect.
The left side.
Okay, that's great. So now I'm actually going to take my tuning fork, and we will try the Weber's and Trinet test, which means I'm going to actually ring this, and I will press it onto your forehead, and you tell me if you feel the distribution on both sides the same. I will try it once more. You should feel like vibration.
Yeah.
Do you feel it on your right
On
side?
the right side.
Yeah. And on this side it is worse? Okay. It's interesting. So I'm just going to write this down. So now I'm going to bring it again, and I will put it here behind your ears on your bone, and then when you will stop hearing it, I will put it next to your ear because the bone conduction is actually weaker than the air conduction, so you will hear it for longer when I just like give it here. Okay, so I'm going to put it here, and you tell me when you stop hearing it.
No.
Okay, can you hear it now?
Yeah.
Perfect. The other side. Okay, that was a little too little.
No.
Okay, can you hear it?
Yeah.
Perfect. So I will actually whisper in your ears, and you will repeat the words I said. 99.
99.
32.
32.
Dog.
Dog.
Yellow.
Yellow.
Perfect. So your hearing seems to be fine. Do you happen to struggle with your hearing sometimes, maybe when you are in crowded space such as restaurants? Okay, so you are not aware of any hearing loss. That's perfect. Great. So now, when we have this done, I'm actually going to be palpating your lymph nodes. Okay, so it means I'm going to have to palpate your neck from behind, and also then your supraclavicular lymph nodes, which are here on the clavicles. Okay, so I'm just going to start. If there is anything uncomfortable or painful, just let me know. Okay, I'm just going to move here. Okay, nothing? Okay, perfect. That seems to be healthy and normal. Okay, great. Now I'm actually going to, listen to your cardiac artery. I'm just going to palpate it first. Okay, I'm going to take my and just listen. Okay, that's perfect. That's great. Now that we are at your neck, I'm going to palpate your thyroid, and I'll ask you to swallow. Perfect. Thank you. Okay, and now we will actually get to like more fun parts, which is like I will be asked you to do some movements with your hands. So we are going to look at the upper extremity. Mostly you are going to be resisting me. I will actually push against you, and you will just try to remain where you are, okay? It sounds really difficult, but it's extremely easy. This means you are just going to spread your arms like this.
Okay.
And I will push, and you will try to remain them where they are. Okay? Now on the other side. Perfect. Now have your hands like this. And I'm going to be pressing here. Okay? Now on the other side. That's great. Okay, now you are going to have your hands like this. And I will push. Okay, and now here. Perfect. And I will ask you to have your hands like this. And I will be pushing against your thumb. And you will, yeah. Now the other side. Perfect. Now here. And here. And I will ask you to have your hands like this. With your like this. Yeah, with your ring fingers. And I will actually be trying to, yeah, perfect. That's great. Okay, that is fine. We will try the range of movements of your hands as well. So you are going to make a circle with your arm. And now to the other side. Okay, now the other side, other hand. And to the other side. Perfect, that's great. Okay, so I'm going to palpate your arms now. If you feel anything painful, just let me know. I'm going to start with the shoulder joint. Anything painful here?
No.
Okay. This. Okay, I'm going to be pressing on each and every joint on your hand, and if you feel anything painful, just let me know again. Okay, anything painful?
No.
Okay, so now on your knuckles, everything fine?
Yeah.
Okay, now in between your thumb and pointing finger, anything painful?
No.
No, okay, the other hand. I'm going to start with the shoulder joint again. Okay. So now the end like this, and let's palpate each joint again. Okay, nothing painful?
No.
Okay. Okay, perfect. And now in between. Okay. I'll ask you now to just lay down your hands onto mine. Okay. Now we'll just move your. Perfect. Now on the other side. Okay. That's great. Yeah, I'm perfect. Okay. Now we'll ask you to have your hands behind your head. Now behind your back. Now have your hands like this. And I will give you my finger and you will try to squeeze it. Like this. Perfect. Now on the other side. Perfect. That's fine. I will ask you actually to, I'm going to take something really small. Okay, for example, this. Okay, and you will now just try to grab it with your hand like this. Perfect. And now try it with the other hand. Perfect. Thank you. I told you it would be more fun. Okay, that's perfect. So the carpal bones were not hurtful. Do you sometimes have any pain in those three? Okay, not any like vibration or anything like that.
No, nothing.
Yeah, that's great. Okay, so now we are actually going to move to the pulmonary inspection, which means I'm actually going to listen to your lungs. So I will ask you to turn around if you can. So now I'm actually going to take a listen. So checking the respiration. I will ask you to breathe normally.
Mhm.
Maybe a little bit deeper. Perfect. That's great. Get here. Okay, now here. Okay. That's great. Perfect. That's awesome. I'm going to be palpating where the lung area is, but first I'm going to look at the lung expansion, which means I'm going to look at how much your chest spreads when you breathe deeply in. So take a deep breath in. Okay, that's perfect. Yeah. Okay, so it's symmetrical. That's great. That's perfect. So this is symmetrical. And now I'm actually going to percast the lung fields. That's awesome. Thank you. Okay, now I'm going to just palpate. If you feel any pain, let me know. Okay, I'm going to be starting right here. Around the spine. Okay, so not the spine directly. Perfect. Now here. Great. There was no pain, right?
No.
Okay. Okay. So now I will ask you to probably turn around again, and we will do the anterior chest inspection.
Mhm.
Okay, and I'm going to do first I'll be listening to the lungs again, and then to the heart also. So I'm going to start with the lungs, so I'll ask you to breathe in and out. That's great. Okay, and I'm going to listen to the heart itself. I will be listening in 4 areas. It is here, 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 and here. Okay. Perfect. Now here. Perfect. That's great. So your heart and lungs seems to be perfectly healthy. That's great to hear, I guess. Okay, so now we'll actually palpate. Tell me if there is any pain. I'll be also palpating the sternum. Okay, now here at the ribs. Anything painful?
No.
Okay, then that's perfect. This is absolutely perfect. So, now we will actually go to the abdominal inspection, which will involve you lying down on the table or like massage pad, and yeah. So I will just remove the things and you can lie down. If you want to, you can have your top on. I will just.
Okay.
Yeah. Okay, so now we are actually going to pull your shirt a little bit up. Okay, and I will be first listening to all 4 quadrants. This is the quadrant number 1, number 2, number 3, and number 4, and I'll be oscillating it with my this, and I will be listening to the bowel movements. Okay, perfect. Now the 2nd quadrant. Perfect. The 3rd quadrant. Great. The 4th one. Perfect. Okay, now I will listen to the aorta. Great. Okay. So the bowel movements are intact in all 4 quadrants. So now I'm just going to palpate slightly and you tell me if you feel any kind of pain. Nothing?
Nothing.
Okay, so now I will actually be trying to palpate your organs. So first I'm going to start with your liver, which is around in this area, then with your spleen, which is around here, and then I will try to palpate your kidneys, which will be somewhere around here, okay? So I'm first going to percuss, yeah. Okay, so it will be around somewhere here. I will try to palpate the spleen, and I will actually go in with you. When you exhale, I will go down and I will just press onto your belly. Okay. Perfect. Okay, so the spleen is not palpable, which is very normal, and then we'll just try to palpate the kidney. So again, I'm going to go down with your exhale. Okay, once more. Okay, and the other side. And here. Okay, once more. Okay, that's perfect. Thank you. So now we're actually going to look at your lower extremity. So I will just be inspecting your lower limbs. We will be trying some range of movements test, as well as some neurological tests, which means I'm going to be actually moving your legs, and then you will try to resist me again. So I will start with just the moving of the legs. So I will ask you to just put your knees here. Perfect. Now the other leg. Okay, perfect. Now bend your knee like this and take it to the side above your knee on the other leg. Perfect. That's great. Now the other side. Great. Okay, and now we will try the resistance test. Okay, so first I will actually ask you to try to lift your your right leg. Just try to lift it, and I will push against it. Okay, so you're trying to lift it like this. Yeah. Okay, and now to the other side. Like this. Okay. Now again, try to lift it. Okay, perfect. So I will press against you here, and you will press against me. Perfect. To the other side. Yeah, perfect. The other leg. Okay. Okay, perfect. Now we'll be just palpating your ankle. Tell me if there is any pain. Nothing?
No pain.
Okay. Now here. And here as well. Okay. Now just try to... Okay. Palpate the pulse. Now here. Okay. I will try the Achilles tendon. I will be palpating it. Now with this one. That's great. Perfect. Now we'll try to take something like sharp. I will try with my nail. Yeah. And your, yeah, exactly. Perfect. That's great. Okay, so it seems that you have here a bunion. Yeah, there's definitely a bunion here and here as well, which should definitely be checked more precisely with a specialist. Okay, so I'll write it down into the report. Perfect. I'll just try to, yeah, weight the shin. Perfect. Okay. So I think this is it. I will just ask you to press your toe against me. Yeah, now the other side. Perfect. Now toe again. Right to the other side. Perfect. Okay, so this will be it. The temperature of your leg seems to be fine as well, even at the complete bottom. Okay, perfect. Okay, so almost everything seems to be fine, except it was kind of not normal that you were hearing when I was doing the Renée Weber's test, that you were just hearing it on your right side of the distribution. So I would definitely advise you to see a neurologist.
Yeah.
And then also I noticed that you have at your feet little bunions. So I would definitely have that checked. It could cause you problems with time. So I would definitely go to these specialists.
Yeah.
Otherwise, this is everything. Thank you for your participation, and hopefully see you another time.
Okay. Thank you.
Thank you. Bye.
Bye.